Hey, thanks for passing along your questions. There was hundreds of good ones that sent in. They came down into 6 main themes, and here's good answers to the main 6. First one was, can you explain the difference between hypothyroidism, Hashimoto's, and subclinical hypothyroidism? Many said they're so confused about this. Really happy to help. First thing to think about is that hypothyroidism means two totally different things. Uh, the most likely thing you would expect is that hypothyroidism means a lack of thyroid hormones. Well, that's one of the definitions. The other one, however, is a category of lab findings that may produce future hypothyroidism or might correlate with thyroid symptoms, but not necessarily a lack of thyroid hormone, okay? So hypothyroidism means too little, or it means things that could go with too little at some point in the future. Specifically, what's called suboptimal hypothyroidism is where the TSH is high normal, T3 is low normal. These situations can cause thyroid symptoms, but not from a lack of thyroid hormone. Then subclinical hypothyroidism, that one is really tightly defined as a TSH that's above range, it's elevated, and T4 is still within range, it's still being made. So this is a case to where there's a future risk of the thyroid slowing. There can be symptoms present, but there's actually not a lack of thyroid hormones at present. So there's those two. You didn't ask about this one, but the one that really is hypothyroidism is called overt hypothyroidism. That's where the TSH is way over 20, T4 is way below range. Now we're in the territory where there's a lack of thyroid hormone, cut and dry. Hashimoto's is the immune attack that is the most common cause of hypothyroidism in the modern world. Now, it's a separate thing. So you can have the immune attack without hypothyroidism, and it can still cause symptoms and risks. So high level, the most common single thyroid issue is Hashimoto's without hypothyroidism. Hypothyroidism, in the real sense, affects 1% of people or less. There's a lot of vague things that are collectively called hypothyroidism that really aren't a lack of hormone. So that's how they relate. In terms of what helps briefly, when there's not a lack of hormone, an addition of hormone doesn't help, meaning thyroid meds don't help. So if someone's thyroid is out, if they have overt hypo, meds help. If they have subclinical, suboptimal, Hashimoto's without overt hypo, meds don't help. In all cases, close regulation of dietary iodine can make a huge difference. Number two, what causes thyroid antibodies to go up and how can I lower them naturally? So thyroid antibodies, biggest single factor is a genetic variation. Thyroid disease is largely genetic, and the genes involved make the body respond differently to iodine. So amounts of iodine that are fine for others can trigger an inflammatory response. Now, the antibodies you're asking about are primarily antithyroid globulin and antithyroid peroxidase. Well, thyroid peroxidase, its job is to oxidize iodine. Thyroglobulin, its job is to store iodine. And that's why when the body doesn't respond right to iodine, these are the things that get inflamed, and these are the things that get attacked by the immune system. So the biggest single thing you can do to improve it is to control iodine intake. Iodine's not bad, we need some. Thankfully, we get some in nearly all foods. But if we're even slightly above a window of 200 micrograms at the upper limit, if we have the genes making us prone to thyroid antibodies, that's when we get the antibodies running higher. Now, micronutrients can also help. The three with the best documentation are selenium, inositol, and nigella powders. I made these into a blend called Antibody Support. Those are all ingredients clinically proven in human placebo-controlled studies to safely lower thyroid antibodies. Good question. Number three, if I've been diagnosed with Hashimoto's and hypothyroidism, will I always need to be on meds, or can I ever get off them naturally? Sure, good question. Uh, if it's Hashimoto's without overt hypothyroidism, you don't need meds. Just yesterday, I talked to someone who barely had positive thyroid antibodies and had totally perfect thyroid function. And her doctor wanted to put her on thyroid medication. There's no reason for this. Thyroid meds don't help antibodies, and they cause risks when they're taken unnecessarily. So if you were giving them for Hashimoto's, they may not be needed long term. Now, if you're on meds you don't need and you haven't been on them forever and you haven't been on an overdose forever, nearly all cases people can taper or come off. With hypothyroidism, if it was overt hypo, meaning the gland really shut down, there are people who need medications, but not everyone needs them long term. If the thyroid is gone, they're needed long term. In all other cases, they may not be needed long term. The way you know about that is by working with a doctor, doing a gentle taper, watching results, and then continuing onward. Most large studies now on thyroid medicine deprescribing and tapering do involve iodine regulation. So being aware of the extra iodine, avoiding the obvious hidden sources, that can help the whole thing go better on you. Large studies, which include most people in the studies who really did need to be on meds at some point, have shown that about 84% can take less and do fine, and about half can come off and do fine. So many don't need them long term. Number 4, despite being told my labs are normal, I still feel terrible, fatigued, hair falling out, weight gain. Why? Yeah, great question. Now, we're talking about thyroid labs, and this could be someone who's on medication or not. If you're, in any case, if your thyroid levels are now normal, but you still have a lot of thyroid symptoms, there's reasons for that. One big one are what's called the comorbidities. These are conditions that commonly pair along with thyroid disease. Asking about hair and fatigue, a big one there is anemia. There's obvious severe anemias, and there's milder versions like one called latent iron depletion. This affects nearly 90% of people with thyroid disease, and it can cause symptoms in addition to a lack of thyroid hormone or instead of a lack of thyroid hormone, including these exact ones. Other common ones include adrenal stress, adrenal dysfunction, adrenal insufficiency. These are also more common with thyroid disease, and they can overlap with those symptoms. Two more to think about: atrophic gastritis, also called thyrogastric syndrome. This occurs in 30 to 40% of people with autoimmune thyroid disease, and it causes this exact stuff. One last one to mention is PCOS, polycystic ovarian syndrome. Also a common overlap with thyroid disease, a big driver of hair loss, and also fatigue symptoms. So those are comorbidities. Now, another big thing that can do all of this with normal thyroid labs, but thyroid symptoms of hair loss and fatigue, is Hashimoto's. So regardless of your thyroid levels, if you've got a big elevation of thyroid antibodies, they can do this. That's called euthyroid Hashimoto's. And it's been shown to cause hair loss, fluid retention, fatigue, anxiety, and many more issues. It's a real thing. That's why it's important to check for thyroid antibodies, and if they are up, to make sure that they are safely and appropriately managed. Number 5, why do some people feel worse on thyroid meds, especially when T3 goes down after starting T4? This happens a lot. The first scenario, which is by far the most common, is the meds were not needed. Now think about this. If your body is doing just fine, thank you, on making thyroid hormone, but your body's intentionally lowering or altering thyroid hormone because your health is off in some way, what happens if you fight that? And what happens if you push back and just pour more in? Imagine that your car is running slower because it's got, bad gas or a weak spark plug or whatever. If you stomp on the gas harder, it's only going to make it run worse. And it's the same way with your body's thyroid axis. If you're intentionally down regulating that and you just pour in more thyroid hormones, what's going to happen is your body's going to fight harder against thyroid hormones. And the paradox is that in many cases, you'll see symptoms of hypothyroidism get worse. Even though you've added more hormone in, you're doing more of what your body doesn't want, and therefore the symptoms get worse. Now, if you do mega doses of thyroid hormone, or if you do a lot of T3 as well, in some cases you can force through and you can feel better for a little while, but ultimately you're still just working against your body and it doesn't last. The results don't persist. Sometimes it'll be a game to where every time you step a dose up, you're better for a little while, but within a few weeks or a few months, it lapses again and eventually it becomes a problem. And that's the common cycle a lot of people are put on. So by far the most common reason you can feel worse after going on meds is you didn't need the meds to begin with. Another simple one, which is related, is that you're on an excess dose. Maybe they are needed, but you're taking more than your body requires. This is a weird one, but doctors are often chasing a certain blood level of T3 and T4. And if you overdose on medication to try to do that, you may also make the body thyroid resistant. So this is a case to where the right amount can work better than even a slight excess. Once you're above your body's narrowed preferred window for thyroid hormones, your body resists that. You get rid of them faster, you resist them more, you prevent them from getting inside of the cells, and you can feel like there's none there, even if there's too much there. Now, another scenario that happens is that some people who require medications and are on a good amount and have been pretty well screened and managed for other comorbidities, they're just going to do better when T3 is part of their therapy. It's totally legit. It's not something we always think about as the first consideration. It's not the most common, but it totally does happen. So what does that look like? So you mentioned when on T4 meds and when T3 goes down. So that can be a matter of converting. And simplest first step is making sure your body has the right nutrients for healthy conversion. In the thyroid specific formulation supplement line, there's a blend called T2, T3 converter. It's to help your body make T3 and also make T2. These are important hormones that help you feel well. Even if you're on medication, you can get the best use of that. Now, for some, their best answer is to have T3 included. That can be a T4 medicine like Synthroid or Tirosint, plus a small dose of Cytomel or generic liothyronine. Or that could be completely changing to natural desiccated thyroid, which has T4 and T3 altogether. But for some, that's completely life-changing. It's not a good fit for everyone. Those who are quite old, who have heart disease, who are pregnant, it's not appropriate for them. But for others, it can be a consideration if the other things have been looked at. Kind of curious, but T3 blood levels don't always predict that. So there's some that have fine T3 levels, but they still might do better on T3. And there's some that have lower T3 levels who won't do well on T3. So I think more in this case about the total dose, the person's symptoms, what else have they done, but those are the main considerations in a situation like that. The sixth big question that I got was, what should TSH levels be when trying to conceive, and does a high TSH affect fertility? So before I get into this, I want to make a distinction. This is a tricky one. There's just a straightforward answer of where's the best level for the TSH, but we've got to think about for someone who's not on thyroid medicine or someone who is on thyroid medicine, it's a different answer. And we also have to think about when is a TSH so high that lowering it with medications is helpful, and when is a TSH high enough to where it may be a risk, but medications still aren't helpful, because that happens too. It's easy to assume that any time a TSH is higher than ideal, that the answer is to start medications, but the one doesn't always follow the other. So with all that buildup, if someone is on thyroid medications and they require them and their TSH is over 2, that can be a factor for their fertility, and it can be worth adjusting their medications accordingly. It's also worth mentioning that regardless of TSH levels, thyroid antibodies can affect fertility. If antibodies are up, they are worth screening for and they are worth managing. Now, if someone's not on thyroid medication, if their TSH is between 2 to 5, it may negatively affect their fertility. Medications do not likely improve their fertility. I met with someone, actually she reached out to me a couple weeks ago. A year or so ago, I first interacted with her. Her doctor got a second opinion with me. She had a TSH of roughly 6 and she was wanting to conceive. She didn't wish to go on thyroid medication. I talked to her about the thyroid reset diet, how to do that in her situation, and she lowered it. She got pregnant, and a few weeks ago she reached out and said, hey, I had a healthy pregnancy. I've got a healthy baby. Thank you. So that's a common story. If it's up by a little bit, diet can make a big difference, both in terms of helping the TSH and helping the fertility side of it. Now, if you're not on medicine and you're between 5 and 10, do medications help you? Is it worth starting medications? That data is not clear. I would argue for someone to first attempt dietary change and make sure there's not other factors affecting the TSH. It's a little ambiguous. If there were no other factors, if they didn't improve, could be a consideration. Otherwise, no. When TSH is above 10, our best evidence is that, yes, it is worth starting medication for purposes of fertility. All right, Dr. C with you. Thank you for those awesome questions. I'm always here to help. Stay in touch and reach out when I can provide some more insights.